in your journey, it is, it was good to learn that community is also happy with the services provided by the embassy's outreach.
Yeah.
What caught our interest was the 7-step health and hygiene program that you are implementing. And that is in and around Bengaluru, I believe. Can you please elaborate on that program?
Yeah, so currently in Bangalore, we have 25,000 government school children that benefit from a health and hygiene initiative. It started 6 years back when one of our corporate tenants in our office parks, business parks, reached out to us and said that, can you help us identify a school where they were in the business of medical record keeping. It's an American company. So they wanted to create health cards for children and also do some level of testing. Our relationship has been very strong, and it grew from that first conversation to 25,000 children benefiting today. What we really noticed in government schools, sir, is that while the government has a clear sort of plan to, screen children and treat children, as you know, it doesn't happen in the way it should happen. We found that because we noticed the way eye tests are being done in government schools versus our machines with, those optal machines going in, actual, doctors, qualified doctors sitting there and checking a child's eye through, like how you and I go to an eye checkup and we see all those fancy machines. We do all of that today, and we realized that what was going on in the past was that, it was just a random sampling of children's eyesight. What really hit us hard and made us conviction very strong, saying this is an area of work for us, was 30% of one school that we tested needed eyeglasses. Almost 50% plus in every single classroom needed dental intervention. And malnutrition, I wouldn't say was very high, but there is definitely scope to improve their nutrition quotient. Yes. Skin diseases was rampant.
Quite common.
Toilets and the facilities of drinking water was, not at all acceptable standards. School cleanliness was at the mercy of one, watchman's wife who probably lives in the vicinity and comes and goes as they please. So it's not a very structured sort of approach to health. What happens after screening? There was no answer. Where is the record of the child kept? Again, ambiguous. So we designed a 7-step program, which is mostly preventive. So there's a support to ensure that sump tanks, storage tanks, drinking water, RO systems, all are functional and serviced manually every single year, maybe in a quarterly basis. There's a calendar for that. So drinking water was taken care of. School maintenance, which means fumigation, daily classroom maintenance, daily toilet maintenance with actual chemicals. I'm saying this because it happens, but it happens without even soap and, disinfectants in some schools. So we have fortunately, Embassy has a large facility management arm. So we use them, and it's a very professional sort of approach to every single school, where we keep a timetable of how we do maintenance. Those were preventive. We do fumigation and clearing garbage from the vicinity of every school so that no disease is spread. We have several steps of building awareness with children, from posters that will tell you how to wash your hand. There's a soap available when the child goes to the tap. The soap is replaced regularly. In the toilets, we have, just like you and me, when we go to a hotel or an office, clear signages telling children what happens if they're not clean in the toilet. Building COVID awareness is something that we are very clear about. It's everywhere. And keeping their own classroom and desks, free of litter. So it's been a long journey for us, but we use a lot of our employees to go in and educate these children with all of these awareness building programs. Treatments, of course, as I told you earlier, we partner with Practo, Address Health, Carl's Eyes, etc., which are these large professional organizations that come in, set up a 2-classroom hospital-like or a clinic-like feel. The dental chairs come in, doctors come in white coats, optal machines come in, and actually So with the help of our corporate partner, we maintain every single child's health card. And wherever there is an intervention like a scan or an operation or anything beyond, what can be delivered in a classroom is completed for them through a, annual trust that we have. So that's about it, sir. And then we went back and spoke about it to our new commissioner this time. He was really happy because his vision was, this is what he wanted. And he was, obviously, he's got challenges to do it across the state. So he was grateful for our work. A lot of corporates have joined us in this bandwagon. And that's very special because the corporates understand the design. They know that this is not some, sloppy one-time approach. And we've jointly hired a colleague who manages the show for us as a, at the ground level. And we partner with the Bangalore North Roundtable, who is our NGO partner who doesn't charge us a single pie to get the money routed to the right suppliers, etc. And 3 times a year, we give children these beautiful health kits that has everything from an oral hygiene kit to cloth masks to sanitizers, soaps, shampoo, just anything they and their immediate family need to keep themselves safe. So when COVID came, being hygienic, being responsible for your own health was already sort of ingrained in the children. And I feel that that was a blessing in disguise. We didn't have to start from scratch anyway. Yeah.
It's quite, I'm really impressed and quite interesting to know all these initiatives. But I completely resonate with you. Health of children is something required to be considered on priority. And our government of India is also giving thrust through Ayushman Bharat School Health Program now that has to be implemented in complete letter and spirit actually. And I must tell another experience of mine. I also suggest you may also include hearing disability, because this is one of the second most disability in the country and most neglected disability. In our program called Sughamya Shiksha, we give scope, more priority to hearing disability, because that's very easily and conveniently linked to learning disability. Like they think that child is not up to the mark to learn. They won't even understand the child is able to listen properly and see properly. So that's the challenge actually. So if you do early detections, early screening of some of that is disabilities, it can be solved and cured very efficiently.
Yeah,
so
it's absolutely a good idea, and I think we'll consider it, sir. Yeah.
And moving to the next discussion, the embassy groups being a leading developer. You have all the required technical expertise for improving the school infrastructure besides providing financial resources. And you mentioned about that. You in fact, you delighted the local school and community with your interesting design, school designs, etc. What has been the noteworthy changes that are carried out through your interventions, specifically on infrastructure development?
So I think there are two folds, sir. One is when we do repairing an existing building or renovation process, we create an atmosphere of learning from something that is like a dingy, a damp classroom space to a beautiful, bright learning environment with new furniture. So I think that goes a long way, not only to protect the health of the children, because typically when we take up a renovation project, the structure is okay, but everything else is not okay. There is absolutely no sign of a flooring. Every wall is leaking. The roofs are in a dilapidated state, etc. So there is a tangible change you see when we do the pickup, and renovation. When we look at toilet blocks, right? I mean, I can show you pictures at a later date, but there are times when there's no water. You can't even open the door to the toilet. It's broken. So from that to a completely working toilet system that is maintained daily is a delightful sort of experience when children go in. And enrollments has always been a very clear indicator for us when we build a new school. We started building a school recently at about 650 children. And today it's at about 30% more enrollments. So that's a clear indicator for us that building a new school is one way of bringing back children to government schools. Also, as you know, government schools get vandalized by the public after school hours. All kinds of activities that any child should never be exposed to happens there. So in all our designs, we have integrated a system wherever possible to keep it secure from public entering. So in some cases, we've not been able to do it because it's an open sort of formatting school, but we've used security and design to provide safety for the infrastructure that we put into schools. So yeah, I think the whole atmosphere changes with the intervention, and we are able to also provide areas for computer labs, libraries, play areas, etc., which were otherwise never a part of the original scheme, right? So I'm sure it makes learning more motivating and engaging for the children.
Very nice.